Hello, everybody, and welcome back to us Democrats here on Access Nashua. My name's Dave Tenza, Chair of the Nashua Democratic City Committee. Thank you for joining us again this week. One of the things I don't think gets reported on enough here in the city is how many influential people we have in the legislature. We're fortunate to be joined by one of those people here today, Representative Cindy Rosenwald from Ward 3 here in the city. Representative, thank you for coming on the show with us tonight.
Thanks for having me, Dave.
When I say influential people, you've been in the legislature for a number of terms now, and you are vice chair of the House Finance Committee, overseeing Division 3, which handles Health and Human Services. Is that correct?
That's right.
So we've heard, especially as the new legislative session gets going here, one of the biggest issues last term last year in the legislature and this year is going to be Medicaid expansion. And you have been a really key figure in the House bills that have come out in Medicare and Medicaid, excuse me.
We're going to talk about that.
We will talk about that. But in the whole process, and let's start from the beginning, because as you may know, Representative Gidge joins me on the show a lot as my co-host, and this is a story we have talked about week in and week out here for the last couple months, because it is such a major issue for the whole entire state, especially the city of Nashua and the different populations that we have here in the city. But let's start from the beginning. Could you tell us, how did this whole debate over Medicaid expansion at the state level, at least, begin here in New Hampshire?
Okay. So as part of the Affordable Care Act enacted in 2010, there were two big insurance reforms. One was the enactment of the health insurance exchanges with tax credits and subsidies for individuals who were low to moderate income. But for the population that is the lowest income, those below 138% of poverty, which, to lay this out, is for a one-person family about $15,800 a year.
Okay.
So that it is for the population between 0 and that, the Affordable Care Act said Medicaid will be expanded to cover that population. Now, Medicaid was enacted by Congress around the same time as Medicare in 1965. It's thought of as a health insurance program for people who are low income, but that hasn't exactly been the case.
Okay.
It's
who
low-income children. So New Hampshire's Medicaid program is currently low-income children, low-income pregnant women, low-income adults with disabilities, and low-income elderly.
Okay.
But if you're just low-income, it does not cover you.
Okay.
So essentially, it becomes, under the Affordable Care Act, a health insurance option that's a partnership between the federal government and the state governments.
Okay.
It becomes a health insurance program for people who are low-income adults.
Okay.
And that was mandatory in the law.
It was, man. Let me ask you this. Do you have a sense of who the people are in our community who are within that $11,000? And for a family of 4, it's about $28,000?
No, it's a little bit more than that, I think. But yes, we do know actually quite a bit about them. They're working in the service industries. It's, waiters, people in the beauty industry, hairdressers, people who do manicures, bus drivers, construction workers, some seasonal workers. So people who are very, very important to the life of New Hampshire.
Sure.
But don't make a lot of money, may be self-employed, or work for very small companies that don't offer health insurance, plus they're low income.
Sure. And so these are working people, though. These aren't people
These
necessarily.
are working people. They're not necessarily working full-time. Many of them have health problems, have mental illness, maybe have had an injury in a previous job. So many of them, we think, are not working full-time at capacity,
Sure.
but with proper health care could actually improve their health status enough so that they could work more, earn enough money to not qualify for Medicaid.
Sure.
But let's talk about the reason we're having the discussion at all. As I said, this was part of the Affordable Care Act that all states had to expand their Medicaid program. But in 2012, the Supreme Court decision that said the individual mandate was constitutional also said it wasn't constitutional to penalize states who didn't expand Medicaid. So Medicaid expansion became optional.
Sure. Which left it up to the states, and there are about 7 states that have not decided whether they're going to accept the Medicaid.
I think 6 or 7.
6 or 7. New Hampshire being one of them. We're still in debate.
Right.
Some states have outright said, no, thank you, we're not going to expand Medicaid. Isn't that correct?
Yes, and if you look at the map of where the states are, it's essentially what I think of as the Plains states and the South,
Sure.
who have said no to Medicaid expansion. Now, interestingly, many of those states have some of the poorest and least healthy populations and would actually benefit the most.
Right.
But New Hampshire is the only state in the Northeast that has not yet decided. All the other Northeast states have realized that the investment in their economies and in the health of their populations is an offer they can't walk away from. Right. And that's what the New Hampshire House Democrats and the Senate Democrats as well have said yes to, and Governor Hassan.
Sure. And you said this was a partnership between the state of New Hampshire, will be a partnership between the state of New Hampshire and the federal government. But can you explain how the program is funded, at least for the next 5 years?
Yes, well, Medicaid in general, the federal government pays part of and the states pay part of.
Right.
But this particular Medicaid expansion is unprecedented in that the federal government pays 100% of the claims costs for the first 3 years, and then over the next 3 years steps that back down to 90% of the claims costs going forward into the future. And just for comparison, most of New Hampshire's Medicaid program, we pay 50% of.
Right.
So this is a huge difference that we would pay at the end 10% of, not 50%.
Right. Which is 10% is probably still a good amount of money, but the benefit to the state, what would be the benefits to the state of New Hampshire by expanding this program?
Let's start with the people who would be covered. We're
Sure.
talking about 58,000 people in New Hampshire who would become eligible by nature of the fact that they are between the ages of 19 and 64 and have incomes below 138% of poverty, or that level of $15,800 a year for a family of one.
Sure.
And are not otherwise eligible. So they're not disabled or pregnant or a child.
Sure.
So they clearly would benefit from having access to health insurance. There have been some interesting studies in other states that have previously expanded Medicaid. There was one study reported in the very prestigious New England Journal of Medicine, looked at 3 states in aggregate who had had a previous expansion of Medicaid. It was Maine, Arizona, and New York State. And they found that for the population of adults between the ages of 33 and 64, there was a significant decrease in the rate of death in that population.
Which only makes sense if people are getting more medical care, their
They're
health
not-
will
yes.
improve. And
Right, and it was a significant decrease in the death rate in that population.
sure,
In Oregon, which is a study over a short period of time, only 18 months, it's very hard to change the status of a population or the behavior of a population.
sure,
And the opponents of Medicaid expansion point to the lack of statistically significant changes in health status in Oregon. So even though all the metrics were going in the right direction, they hadn't achieved a significant level in 18 months, which you wouldn't expect. But what they did find in 18 months was an almost total elimination of the catastrophic financial burden of illness or injury in that expansion population.
sure.
So there's the financial security aspect as well.
And isn't that such a huge, I mean, I think is probably one of the biggest issues with Medicaid expansion, because these people who are in our community working hard, not making a lot of money for what they do, you know, accidents still happen to them, major medical issues still come up.
You take someone young, and if something happens to them, it's bad.
Right.
It's either a terrible accident
Right.
or a terrible disease.
Right.
So it's a catastrophic change in their health status in someone who's young. And I think a third of personal bankruptcies involve medical debt.
Sure.
So it's huge. It's a huge thing. Now, in terms of the amount of money we're talking about, New Hampshire is a state that sends more tax money out to the IRS than we get back.
Sure.
This would bring back $550,000 each and every day of our own tax money to be reinvested in the New Hampshire economy.
And do you have a sense, would that make it more, obviously it would make it somewhat more even from what we pay into the federal government as taxpayers?
We'd still be a donor state.
Sure.
But
So the people who are against Medicaid expansion here in New Hampshire
are funding Medicaid expansion in California. If
Right.
we don't go forward with this, we could probably just adopt a county in California and say this is brought to you by the taxpayers of New Hampshire. Medicaid expansion would lead to the creation of 5,000 new jobs in New Hampshire as well.
And what kind of jobs would those be?
They would be jobs in every sector. I mean, because not only would there be growth, more health industry jobs where our population's aging anyway in New
Sure.
Hampshire, and that's been one of our growth sectors is the health sector.
Sure.
But just general economic growth. So if you are not spending $1,000 per family per year on medical treatment, you're spending that on something else in New Hampshire.
Right.
Maybe you're going to restaurants or the movies. Maybe you're going to the state parks. You're doing
Sure.
something else with that money in New Hampshire. And so the entire economy is projected to grow more with Medicaid expansion than if we don't expand Medicaid.
And because this is a figure that the state parties, New Democratic State Party, for anyone who wants to go on their website now,
ticker.
nhdp.org, they have a ticker to show how much money
Per second.
the state is losing
Right.
By not expanding Medicaid and accepting this federal money. Where does that $500,000 a day come from? Is it the economic incentive that all this federal money would be?
No, that's actually the Medicaid claims costs
Okay.
that are not being paid. But if you look at it, they've split it up by Senate district.
Yeah, right.
And in Senate District 13, which is mine, it's about, I think, 2/3 of Nashua.
At least, probably a little more.
I think as of yesterday, we had already lost $150,000 in just 1 week. So, in 1 week, the state has lost $4 million of our own tax money coming back to New Hampshire. Next week, it'll be $8 million. Over the year, over the state fiscal year, we would lose a projection of $340 million of our own tax money that could be reinvested in our economy here, bringing new jobs, creating a healthier population. It's really no wonder that the Business and Industry Association of New Hampshire has supported Medicaid expansion, because they understand that a healthy workforce is ready to work.
Sure. And I think it affects the community in ways that we don't necessarily see or think about, because it would allow a lot of people into treatment programs for mental illnesses. I think
And drug and alcohol, right.
Drug and alcohol, which has been cut back because the state hasn't been able to fund it over the last few years. So there are fewer beds because there's not the money available for it. Do you think that Medicaid program in some way would help fund those beds? I mean, if there's insurance money available.
Yes, but where it would really make a difference is you'd probably have no clients left, or no people you're trying
my day
in
job.
your day job
Yeah.
you're trying to prosecute, because as you know,
Which is not a bad thing.
about 75% of our inmates have either a drug or an alcohol
Sure.
problem.
Sure.
And for the expansion population of Medicaid, there is a requirement to provide drug, alcohol, and mental health treatment at parity to the rest of health care.
Sure.
So that means that we could actually provide treatment of drug problems. We've seen a huge spike in crime in Nashua. I have heard much of it is drug related. We don't have very much drug treatment in this state.
We don't.
When people are released from the House of Corrections, they don't have health insurance, they don't have jobs.
Right.
They're sent home maybe with a week or two worth of their mental health medication. With Medicaid expansion, they would leave jail and have health insurance and be able to continue and get into treatment. And I think we would see a major savings in corrections.
Which would be a good thing, because of all the things that we could be paying for.
Well, it would help
as
our
a county.
property taxes, wouldn't it?
It would be. It would definitely help the property taxes, which, as we know here in Nashua, have only gone up. So
That's correct.
yeah. But I want to talk just a little bit about the political process, because the governor called both the House and Senate back in a special session in 2013 in November. And the House passed Medicaid expansion bill, or a Medicaid expansion bill, and then the Senate failed to act on it. The Senate Republicans failed to act on it. Explain what the House passed again just this week.
Okay. Well, let's just say that this is the third time the House has passed Medicaid expansion, because the budget, the House budget, also had Medicaid expansion in it. So in June, the House had passed Medicaid expansion, actually in March, not in June. The House passed it then. We sent the budget over to the Senate with Medicaid expansion in it. And the Senate said, whoa, we haven't had time to think about it. Well, we'd been thinking about it in the House since, some of us had been thinking about Medicaid expansion since the Affordable Care Act was passed in 2010.
Right.
But since the Supreme Court decision in June of 2012, some of us had been thinking about it a lot.
Right.
So the House had a series of public hearings on the budget, which focused on Medicaid expansion. We actually had one public hearing that was devoted entirely to Medicaid expansion. And the Senate said, well, no, we haven't had time. We need to think about it. So we agreed with them to set up a special commission to study Medicaid expansion.
Sure.
Originally, they wanted to study it for 18 months. So we would have lost about $500 million over that 18-month period if we were delaying expansion by that long. And they finally agreed to have a short-term study commission. So we reported by October 15th this past fall, we had a bipartisan recommendation that New Hampshire should expand Medicaid and do it in certain ways.
Sure.
And the governor called us into special session, and we brought forth a bill that looked very much like the recommendation of that bipartisan commission.
And there were Republican senators, obviously, who were on this bipartisan commission.
Yes, and one of them supported the recommendation. There were 2 Republican senators on the commission and 1 Democratic senator. So 2 of the 3 senators voted for the commission's recommendation, 1 did not. So we were called into special session. The hope, everyone's hope was that there would be one bill. There would be an agreed to solution. And unfortunately, that didn't happen. So there were 2 bills. There was a House bill and a Senate bill. The House passed its bill. The Senate Republicans could not get the 13 votes out of their own caucus they needed to pass their plan. And their plan was frankly problematic. It established some timetables that were not realistic, that couldn't have been met. And the result would have been that after 1 year, right before Christmas next year, 50,000 people would lose their health care right before the holidays.
And so that, and what would be the reason for that? Can you just briefly explain, if you can, the difference or the sticking
We're going
point?
to go into the weeds here.
Just briefly.
So the Senate and the House was agreeable to do this, to take this population of the 50 or 58,000 people and say, okay, but we instead of giving you the exact same program that our current Medicaid population has, we're willing to do that for a little while, put you into the private managed care program. We have contracts with 3 private insurance companies to serve the Medicaid population. But after a certain period of time, we want you to go out onto the new health marketplace, and we're going to pay your premiums. The Medicaid program is going to pay your premiums, but you're going to use that assistance to purchase commercial insurance. Now, you know, New Hampshire has only 1 carrier on the marketplace right now, Anthem. Next year, they're apparently going to have 2 more, but it's a narrower network. It doesn't include every hospital in the state. In fact, when you go, well, Concord Hospital is not in it. So there are places in the state, Sullivan County, where Claremont is, doesn't have a hospital in the network at all. So it's problematic for the Medicaid population that is very low income, may have transportation problems, hasn't had access to health insurance in the past, doesn't know how to use the system, and all of a sudden we're going to try to put them into some kind of a commercial product where they're not getting coordinated care, they don't have a medical home, they maybe aren't using their insurance in the way that makes the most sense for rational use of the system. So we couldn't agree on the timing with the Senate. We wanted to make sure that the marketplace was robust enough. There were enough carriers and enough carriers who knew how to serve that population. And the Senate wanted to rush into it. And we believed it was their plan was destined to fail. And they couldn't get enough votes to pass it anyway, so they had to lay it on the table.
When you say they couldn't get 13 votes in their caucus, meaning that Senate
One
Democrats...
of their senators wouldn't vote for any Medicaid expansion, and the Senate Democrats understood that the Senate Republican plan wasn't going to work.
So that leaves us where, come January 1st, there's no Medicaid expansion, but there's an opportunity every quarter every
Yeah,
3
I mean,
months?
we can opt into it whenever we want,
Okay.
but the 100% reimbursement of the claims is written into the Affordable Care Act. That's statutory as only covering calendar years 14, 15, and 16.
Okay.
So that clock is ticking already.
Sure.
We could decide in 2017 that we wanted to expand Medicaid, but the feds will only pay 95% of the claims that year, not 100%. So it's in our economic interest to do it soonest. We've had 4 public hearings on this in the House. We've worked this. I'm practically dreaming this at night, and the Senate is still saying the House is trying to rush into this. It's just not the case. We've really studied this.
And this is something that's, like you said, has been coming since 2010, 2012. I mean, even if the Supreme Court didn't say, well, it's up to the states to decide whether they want to accept this, New Hampshire would have had to have been ready to implement
This
the Medicaid
anyway.
program.
That's exactly right.
So-
And, you know, we have done the work. We've talked to the national experts. We've had them in New Hampshire to talk to us. We've talked to other states about their experience. We've read every scholarly journal article on the subject that there is. We have really investigated this to an extent that is really unprecedented.
Well, we're hoping to do whatever we can here in Nashua to make sure this happens. I know that all the representatives, the Democratic representatives, are in favor of this.
And our senators as well.
and the
And
senators.
Senator Gilmore's been a real leader.
Sure, with her,
this.
especially with her, I'm
Yeah.
sure with her background. And Senator Lasky is
She is
100% behind it.
100% behind it.
So I guess all we can do at this point is wish you the best of luck.
Thank you. We're going to keep working at it.
Yep.
We passed it yesterday again to the Senate. They haven't sounded very receptive, but I have also made plans to file another bill. I'm able to bring in a late bill coming out of the study commission. So within the next month, I'd say I'll be introducing another Medicaid expansion bill.
And will that be different than the bill that the House just passed yesterday?
I think it'll probably be similar, but a little bit different. But by then, we will have lost, I don't know, $30 million, $35 million by the time we even have a public hearing. Money we'll never get back, and it's our own tax money that will help our citizens, our businesses,
Right.
our hospitals, our mental health centers.
Our communities, I mean, if people are, just a little bit better off, a little bit more secure, they're not going to be in our community, they're going to have a better life, we'll say.
They certainly are, and the one other thing I would say about it is that just as it's optional to get into Medicaid expansion, it's the state's option to quit whenever.
It is, so
whenever. We could opt in tomorrow, and a week later we could say, no, we changed our mind.
Okay.
And we could just say, oh, thanks, but we've changed our mind. So
the Republicans who say, well, there's no guarantee that the
but
federal
there is a
government
guarantee.
will.
There is. That's, the Supreme Court decision made that clear. And B, we've been informed in writing by the Secretary of Health and Human Services that New Hampshire could stop the Medicaid expansion at any time without any penalty. There's no maintenance of effort. There's nothing. We could just walk away from it any day we wanted to. There are not that many programs where somebody gives you money, and you can do that.
So at least through 2017, this is absolutely zero risk to the state of New Hampshire. It's only
That's exactly right.
Only
Well,
upside.
just there's some administrative cost, but it's limited.
We are actually getting down to the wire here. Is there anything else we should know that we haven't covered about Medicaid expansion?
Wow. Please call the Senate. Let them know how you feel. Let your representatives know. If you're living in Nashua, not every single state rep of the 27 of us
Right.
has voted for it. We don't know how many of the expansion, the potentially eligible people live in Nashua, but we do know how many live in Hillsborough County, and it's a lot because we're the biggest county. It's thousands of people.
Sure.
So I would say to people who live in Nashua, let your state reps know that you support Medicaid expansion, that you think this is a win for the population's health, a win for the economy, and a win for our healthcare providers.
Absolutely. And it seems like such a no-brainer, which could be the most frustrating part of this issue, especially for you, who has lived this issue for at least the last year. So
I'm trying not to get frustrated, and I'm not frustrated.
Sure.
I'm not. I'm working. You know, the more people I talk to, including Republicans in Nashua, have been saying to me, I support what you're trying to do. I think the public really understands that this is necessary. We need to have a healthy population. Everyone knows someone who's been ill, who doesn't have insurance, who's worked hard, but just doesn't work for a big employer.
I mean, anyone who pays health insurance premiums knows how expensive it is.
Oh, yeah.
And, you know, those of us who are fortunate to have employer-based health insurance, you know that it only goes up, and even with good health insurance, health care can cost a lot of money. So
It can, but Medicaid is incredibly efficient.
Oh, compared to the private health insurance, it definitely is.
Yeah.
Representative, thank you so much for being here and talking with us.
Thank you for having me.
About
It was
this
a
issue.
pleasure.
And we'll definitely, hopefully, check back in with you after this has been passed, and we can talk about all the good that it's doing for the community here.
Absolutely. I'm confident that it will do a lot of good for the community.
Great. Well, that's about all the time we have for tonight. I'm Dave Tenzo here with Representative Cindy Rosenwald. Thank you again for joining us here, us Democrats here on Access Nashua. Thanks.